And Jill, thanks for allowing us to be here at your clinic, and thank you for the great work you do. I had a chance to meet some of your staff here, and it's been a great, it's been great to hear about the people you've worked with and that you provide care for, and the opportunities here. I want to welcome all of you. I want to say a special welcome to a few of our legislators who are here. Senator Charlie Huggins is the Senate President. He's over here. Representative Wes Keller, Senator Kathy Giesel, and am I missing another legislator? I don't think I am. And I have, let's see, do I have commissioners here? I want to make sure I recognize them. No Bill Struer. Where'd he go to? He was going to be here, but Jason Hooley is here. He'd like to be here. Okay. Well, today we're going to start. I'm going to sign 3 bills, and it really is a great moment for us to recognize the work that many of you did, and to recognize the importance of healthcare in our state. We're going to start with the overall piece of legislation, and then go to the more specific legislation. So the first piece of legislation I'm going to sign is SB 135, which extends the Healthcare Commission. And we've got Keith Campbell, who's a commission member representing consumers, Wes Keller, the ex officio member representing the House, Deb Erickson, executive director of commission, and Barb Hendricks, admin assistant. Would you all come forward, please? Yeah, come on, Deb. This bill was sponsored by Senator Donnie Olson, and are there some others here, Heather, who were involved in this legislation? I want to make sure we get them up. Dr. Hurlbert, yeah, please come up. He's going to hang out in the back. I'm going to have a few of you speak. In particular, we'll start with Keith Campbell. I'd like you to just speak a little bit to the importance of the Healthcare Commission work. I know I'm catching some of these folks on the spot, but really, I'll give them a chance to think for a minute. But the purpose of a bill signing is to really connect the piece of legislation with the people it's meant to serve, Alaskans it's meant to benefit. And so I'd like a couple members of the commission to come forward and just speak to how they've seen the Healthcare Commission, for example, be a benefit to Alaskans. So Keith, would you step forward for a moment?
Nothing like being first. Well, I'm the consumer representative on the commission, with a background in Alaskan healthcare, and of some 40 years. I was a hospital administrator. I've served on many committees over the years, and there's been no one coordinating effort over the 40-some years that I've been in this business. And this is a real step, in my estimation, of bringing a very diverse and varied healthcare system as we have in the state of Alaska. We actually have 3 systems. We have the private system, we have the military system, we have the native public health service system. So trying to get the efficiencies of all these different things is one of my personal goals of sitting on the commission. And that is, I think, to me, one of the important missions that we have. So thank you very much, Governor, for giving me this honor of serving on the commission, and I'll do my best. Thank you.
Thanks. Representative Wes Keller, would you come forward and say a few words as well?
Thank you, Governor. The Health Commission, I see, is tasked with a really spooky and a huge charge, and that is to make sure that our healthcare system is strong, accessible, and it's sustainable. In other words, that it doesn't run in the ditch, it doesn't run off the cliff. We all know with the rising costs of healthcare, there's some real threats to all of us out there in the healthcare world, and the Healthcare Commission takes us on. I've been impressed with the Health Commission members, the other commissioners. The fact that they're open, they make themselves vulnerable to the other parts of the group, trying to work things out, and I'm just delighted that this is extended, and I see the work largely ahead of us. I mean, there's still just huge problems ahead of us with the increases in the cost and the decreases in the revenue. So it's an honor to serve on the commission as ex officio.
And I saved somebody who's been termed the champion for last, Dr. Hurlbert. I'm going to ask you to come forward and say a few words as well.
Thank you, Governor Parnell. It's a real privilege and a privilege to be a part of the Healthcare Commission. As you heard, deals with access, affordability, quality. Healthcare is very expensive in Alaska, about 21% of our state's gross domestic product. We also look at quality. We want to do the right thing. The members have worked hard. There's been support and engagement on the provider community. We also look at quality. Just yesterday, I had the opportunity to transmit an award from the March of Dimes Foundation, recognizing Alaska as #1 related to neonatal mortality rates, infant mortality rates, and low birth weight. And that's due to the efforts of folks here, of the neonatologists and others. But there are lots of folks engaged in quality. We want high quality for Alaska. But it needs to be affordable, and that's kind of at the crux of what the privilege is to serve. Thank you, Governor Parnell, for allowing us to do that.
So SB 135 extends the Healthcare Commission to 2017. It extends that sunset date and authorizes them to continue the good work. I'm going to just sit down here, ask you folks to come around me as I sign. And then we do have to look up and smile for the camera. But they always give me a sticky note so I know what the date is.
It's nice to have good staff.
It is. It's great. Okay, so SB 135 is law. Thank you all. Now we go to the specific, and I because these two bills are sponsored by the same person, I want to do them together too. So Senator Giesel, would you come forward, please? The first one, SB 166, updates our statutes related to certified nurse aides, licensed practical nurses, registered nurses. Many of you here, I know. And then Senate Bill 169, also by Senator Giesel, really speaks to the importance of immunizations, and both personally and collectively. So I'm going to let Senator Giesel speak to these, but I also want to make sure that we get everybody up here. That's almost everybody here now, I recognize, who had a hand in this or who was interested in it. And I'm going to let Senator Giesel talk about the genesis of these bills and why they're important. And then we'll ask a few of you as well to just bring it down to every Alaskan's benefit from these two bills. So Senator Giesel, how about if you bring everyone forward?
Great, I would love to. Thank you so much, Governor. So everyone that had a role in Senate Bill 166 and 169, so the Board of Nursing I know is here, the Nurses Association, AARP is here, Division of Public Health, Department of Health and Human Services, if all you folks could come forward. I'll speak first to Senate Bill 166. So this is a housekeeping bill. Might seem like kind of a sleeper, but this has to do with updating the statutes for the Board of Nursing. Governor, I had the privilege of serving on the Board of Nursing for a couple terms, and actually this bill started when I was serving on the board. We have many obsolete statutes, and of course a lot of lawmakers talk about, well, if we're going to pass a new law, we need to get rid of some of the old ones. So that's what we did in this bill. We got rid of some of the old ones, some of the obsolete things that were enacted at statehood that no longer apply. But we also updated some of the advanced practice statutes and some of the titles. So that's why it was important. I'm going to ask Erin Evans, she serves on the Board of Nursing, to step forward and just speak to the importance of the bill to the Board of Nursing. Erin?
Thank you very much. We really appreciate that this bill has gone forward. It makes our job easier as we represent Alaskans and the nurses in Alaska. Having updated statutes, which are current, makes our job much easier. As I understand it, the statutes have not been updated since the mid-90s, so this is very helpful to us. It also addresses the composition of the Board of Nursing, allowing an advanced practice nurse to be on the board, which is very important to us, as well as nurse educators on the board. So this has been very helpful to the job we do. Thank you.
Great. Thanks, Erin. And Pat Center worked very hard on this bill. She represents the Alaska Nurses Association. Pat, would you like to say a couple words about the bill?
Well, the Board of Nursing is the largest regulatory board in the state, covering about 13,000 people that provide health care in Alaska. So it is very important for us to keep these statutes up to date and make sure that the board can have high-quality health care providers in the state.
Great. Thanks very much, Pat. So the second bill is Senate Bill 169. Governor, I share your significant concern about health care in our state and access to health care and affordable health care. And that's what Senate Bill 169 is about. When we had Senator Ted Stevens serving in the U.S. Senate, he provided ample funds for a universal vaccine program in Alaska so that Alaskans, all Alaskans, insured and uninsured, had access to vaccines. Well, I didn't think about this, but in 2010, when Senator Stevens left the Senate, we lost that funding. This bill actually began with a citizen, as most good legislation does. This is a former constituent of mine from Eagle River. Her name is Dr. Rosalind Singleton. Dr. Singleton contacted me in 2011, and she said, "Were you aware that we've lost this funding?" Dr. Singleton is a pediatrician as well as an epidemiologist. That's a person that studies diseases, their distribution, and their prevention. So, Dr. Singleton, I'm going to ask you, there she is, I'm going to ask you to step forward and say a few words about the significance of this bill.
Thank you, Senator Giesel. Alaska has one of the lowest immunization coverage rates for children in the U.S. Why should we be concerned about that? Because right now in the U.S., after years of measles being eliminated, we have one of the highest rates of measles cases in the U.S. But in Alaska, we've been free of measles for 20 years. That can change very quickly. This bill increases access to vaccines for all Alaskans and will reduce costs and for providers and for individuals receiving vaccine. And that is important to increase our coverage and prevent outbreaks like measles outbreaks from occurring in our state. And I really applaud Senator Giesel for moving forward with this bill.
Thanks, Roz. So right now, in fact, yesterday, the Division of Public Health sent out an alert that we are seeing an increase in influenza. This is an unseasonal time to be seeing influenza, but we're seeing an uptick in it. We need to make sure folks have access to that vaccine. In California, they are seeing an outbreak of whooping cough. This is called otherwise pertussis. It's in one of the vaccines that children get. When infants get pertussis, they are in danger of dying from this disease because of their very small airways, and it's a respiratory disease. We don't want that in Alaska. Having vaccines available will help prevent this. We're seeing an outbreak, as Dr. Singleton said, of measles, particularly in Ohio, but across the U.S. So these diseases are still out there. As a child, I still remember my mother and father having a cloud of grief over themselves when 2 children down the street from us in Fairbanks died of polio. In my lifetime, we have wiped out polio in this hemisphere, in the Western Hemisphere, but it is still evident in the Middle East and Africa, and with the war escalating again there, vaccine is becoming less available there, polio actually could return to Alaska. So this, Governor, I appreciate your interest in public health and your concern about access to health care. This bill will help increase that. So this was supported by AARP, the Community Health Clinics, the Nurses Association, Commissioner Stewart, Dr. Hurlburt, all worked very hard on it, and I appreciate all the support.
Those of you who are members of the healthcare provider community can see what how good it is to have somebody in the legislature like Senator Giesel, who understands these issues, who's practiced in the same area. That's the beauty of our legislative system, is that it is open to anybody, whether you are a fisherman, a teacher, a recovering lawyer like me, or in the healthcare field. The legislature brings together all these experiences and expertise to serve the people. And Senator Giesel has done a fine job with these two bills. So how about if you all would gather a little closer, and I'll sign the nursing bill and the immunization bill into law. Okay, so first is Senate Bill 166, related to nursing and to the Board of Nursing. Okay, now you all have to look up. Okay. All right. Sometimes we get back to the office and I get chastised for not having everybody look up for a group shot. So SB 166 is law. Senator Giesel, congratulations.
Thank you. Thank you, Governor. And my staff, Jane Conway. Jane just did a yeoman's job on this bill.
I know. Through sickness, I almost have pertussis.
Yes.
I didn't here, but I almost did.
And now Senate Bill 169, the immunization bill. Okay, Senate Bill 169 is law.